Well, for a little bit more insight into this, we're now joined by Dr. Henry Kyobe, who's the Incident Commander of the Ministry of Health in Uganda. Thanks very much indeed for joining us. You must be relieved that you're Ebola-free now.
Yes, indeed. It's a great relief for me, not only me, but for the ministry and entire country, but specifically the people of Mubende district and Kassanda district, where the epicenter of this outbreak has been.
Are you confident that it's no longer in society?
I'm confident that the current outbreak or the current outbreak, the transmission has been fully interrupted, given the fact that we have had two consecutive transmission cycles without any case, despite the fact that we've been doing intense surveillance, intense mortality surveillance for Ebola. We are sure the current outbreak, the transmission has been fully interrupted. However, noting that the reservoir where the virus comes from is in the jungle, we can't say that that can't happen. But the current outbreak, we are sure that is over.
It's the first of this type of Ebola virus in about a decade. Have you been able to track what happened, how it came into the Mubende district?
The current outbreak happened very close to the last outbreak 10 years ago. And we think the reservoir should be very close. But I can say that we haven't been able to track precisely where the source is. But we do know that the virus actually lives in the jungle innocently amongst the birds. So most likely, a spillover came from the birds. The methods or the means of transition or spillage into the human population were yet to know.
There are viruses now, vaccinations now for Ebola. Is that not the case?
There are vaccinations for Zaire Ebola virus, but is none licensed for Sudan Ebola virus. What we do have are 3 trial vaccines, which actually came into the country last month, but we couldn't use them because we had actually run out of the individuals who are meeting the criteria, and these are the contacts or the exposed individuals. So we couldn't try them out because we didn't have the participants to be able to participate in these trials. And that means we have to redesign the trials and look in another direction. So to answer you, there are no vaccines for Sudan Ebola virus, but there are vaccines for Zaire Ebola virus.
Lessons learned this time around in terms of preventing. I know it's impossible to completely eradicate it, as you've said, but what can you do to prevent or to manage future outbreaks quicker and safer?
There are 2 things. One, what we can't stop is the spillage from the wild into humans. But what we can do is to limit sustained transmission in humans. And what we did this time, that we changed a little bit of what we did before. One of them is selective limitation of movement, where we placed the 2 districts, the epicenter districts, into limited movement, no vehicles, no enemies of transport in and out, and only allowing transition through these districts. But further, when we had importation of cases in Kampala, what we did use some of the measures, like hard measures like quarantine, for the exposed individuals to make sure that they don't transmit to other people. But in addition to that, recall that this outbreak happened just after 2 years of COVID pandemic. So we had the population on us, and much of the response structures in the country were still standing, and there are these structures that we repurposed for the response for this outbreak.
This is the 8th outbreak since 2000, so public are aware of Ebola. Have you been able to educate them about safety in terms of areas where Ebola could and has proven in the past to be particularly vulnerable? in maybe changing their behaviors and exposures?
One of the things, as I said, is that the transition or the spillage or spillover from the wild, we can't do much from spilling into the human population. But what happens when we have a spillage and have transmission within the humans is where we have issues. One of the issues, and we know that the major method of transmission is contact, and contact with the body fluids of those individuals that are symptomatic. We're talking about blood, we're talking about diarrhea, we are talking about vomitus, and we are talking about all body fluids from infected people. So one of the key measures that we've been advocating for, and we're advocating for going forward, is hand hygiene, hand washing, and consistent hand hygiene. Further, we limited handshaking in this setting to make sure that we limit contacts with people who may have been exposed. So these are some of the things we think, and of course the population has been able to really be part of the response, and they have been able to follow these guidelines from the ministry.
All right, so I suppose, 42 days has elapsed, but that doesn't mean that people should relax. They should remain vigilant.
Precisely. We think that this should be a best practice, that hand washing, consistent hand washing should be part of our lives. Or if you can't wash hands, using hand sanitizers, but also to report those individuals that may have symptoms suspicious of Ebola, noting that we are in a place or in a country which is where malaria is endemic, and the presentation of malaria and Ebola at the beginning is much the same. So it's a very fine balance for clinicians or even other individuals to distinguish at the beginning whether it is malaria or Ebola. But of course, the health workers across the country now have been trained and actually understand and are able to distinguish much of these symptoms using different methods clinically.
All right. These are
of course, this is an issue.
Yeah, these are healthcare workers and professionals, but a lot of people, particularly in the rural areas, my experience, we tend to go to traditional healers and medicine people. So how do you manage in those kind of circumstances where these are not trained to detect the symptoms in the same way?
Precisely. It's a very fine balance of making sure we don't miss it. In this current outbreak, we saw a couple of people attend to traditional healers, moving from place to place. It's something that we speak to, and being able to sensitize the traditional healers also to make sure that they understand that this is not a kind of disease that they should be able to play with. Otherwise, the consequences are lethal. And progressively within this outbreak, we saw the traditional healers pulling back from treating or seeing patients with symptoms consistent of Ebola.
All right. So you're confident that your health systems responded? It was, I believe, difficult at first to manage, but it seems as if you were able to get on top of it.
We were able to get on top of it, and the fact part of the reason was the community. One is that they understood that the problem was with them, and knowing that they are biggest stakeholders in this game, and they were able to take up these measures. They were able to report the people who had symptoms. Some of them are bringing themselves to health care facilities. And we think this is one of the things that have helped us to be able to get the top of this outbreak and interrupt transmission in less than 70 days.
All right, and that's where we'll leave it. Thank you so much indeed. And good news for the people of Uganda that you've been able to do great work in managing this disease. Thank you for your time.
Thank you so much.
All right, that's Dr. Henry Kyobe, who's the incident commander of the Ministry of Health in Uganda. They've managed to contain the latest outbreak. They've had 8 in the last 10 years, since 2000 rather, last 22 years. And they seem to have managed this one. Sadly, loss of life, as many as 55 people. But after a 42-day period without incident, it appears as if it's now contained.